Every night across the country, thousands of physicians log back into their computers after their families have gone to sleep. It is a grueling routine the medical industry calls pajama time. This after-hours work is driven by a massive, hidden administrative load. On average, primary care doctors are hit with nearly 50 distinct electronic inbox messages every single day, each one requiring a read, a medical decision, and an action. And that volume is actively accelerating. Over a recent 4-year period, the amount of time primary care physicians spent just managing their electronic health record inbox spiked by 24.4%. This late-night triage is a major structural flaw in how outpatient medicine operates. It is the primary engine behind an ongoing crisis, pushing physician burnout rates across American outpatient medicine to a staggering 43.2%. The reflex for most practices is to hire more front office staff to handle the overflow. But adding local administrative headcount to this specific issue consistently drives up expenses without actually speeding up the workflow. The breakdown happens because of unstructured triage. When highly urgent queries and routine billing requests enter the system, they dump into the exact same unprioritized queue. With no visual priority, providers must manually review every item so critical issues don't slip by. Adding to the friction is the reality of medical staffing, people who hold the institutional knowledge required to sort the daily backlog. This traditional in-house model operates as a revolving door. It drives overall medical group operating expenses up by an average of 11.1%, while completely failing to protect the physician's time. To fix the inbox, practices are decoupling task management from the physical clinic. They integrate AI-powered virtual teams directly into their electronic health records. By moving to a 24-hour, 7-day-a-week model, an offshore team processes incoming lab results, portal messages, and refill requests around the clock. When the physician walks in at 8 a.m., there's no overnight backlog waiting for them. This is governed by Smart Triage AI. The system instantly analyzes both the specific task type and the patient's underlying acuity score to handle all the initial rules-based sorting. The labor divides efficiently. The AI processes the repetitive, high-volume sorting in milliseconds, leaving specialized human staff to execute complex judgments and handle precise provider routing. This hybrid architecture acts as an intelligent firewall. It ensures providers only see the specific items that require a medical license to address, exactly at the moment they need to see them. We can see exactly how this protects patients by looking at the workflow. A chaotic stream of incoming tasks hits a digital filter and immediately separates into 3 distinct lanes: urgent, routine, and informational. Urgent, same-day tasks are instantly isolated from the noise. Routine items automatically route to specific staff members under a strict 24 to 48-hour service level agreement. The AI constantly monitors this flow. If a task is at risk of missing its deadline, the system flags it 4 hours before it becomes overdue. The team then uses proactive patient communication to close the loop. Reaching out to a patient before they ask about pending lab results or referrals stops secondary floods of inbox messages before they can even start. Because sensitive medical data is involved, this entire workflow operates within a highly secured, enterprise-grade infrastructure, carrying both SOC 2 and complete HIPAA compliance certifications. By enforcing these specific rules, the practice's inbox stops functioning as a reactive black hole. It becomes a predictable, measurable, and remarkably quiet supply chain. Fixing the workflow is only half the equation. The operational economics of these two opposing models reveal exactly why medical groups are making the switch. This bar chart breaks down an in-house hire. Between salary, benefits, training, and turnover, a practice spends $60,800 annually. A Staffingly virtual assistant provides 45 hours weekly for just $21,600. That is a 64% cost reduction, yielding $39,200 in direct savings per position outsourced. Practices can also completely bypass traditional recruiting delays. The entire AI-assisted workflow can be deployed and live within 48 to 72 hours. Curing the 40-task trap offers a rare dual benefit. It rescues the physician's evenings from administrative busywork while serving as a rapid deployment strategy to drastically lower operating costs and scale patient care.